everybody, I'm Dr. Tabor Smith. Welcome to our Spinal Hygiene class. I want to start off by saying one thing that I believe, and I tell a lot of people, is that the spine should be checked routinely, and then it should also be checked and adjusted throughout life. Now, in the next several slides, I'm going to show you why I find this to be true. You see, it's a known fact that in a C-section, a baby's cervical spine or neck can be stretched up to twice its normal length, and in a forceps delivery can even be harder on a baby's neck or an infant's neck. Research shows that in what medical doctors term a normal delivery, the cervical spine can be rotated up to 180 degrees and pulled with up to 70 to 90 pounds of pressure. A well-known medical doctor, Dr. Gutman, also says that there's an 80% occurrence of subluxation just during the birth process. So what is this word, subluxation? Well, here is a definition that I put together, but subluxation is a spinal misalignment or problem area in the spine that causes nerve system interference. It can cause interference to organs, cells, all types of tissues in the body, potentially even leading to an organ failure, symptoms, disease, the disease process, and ultimately, if it gets serious enough, it's possible can lead to early death. And that's why I think spinal hygiene and awareness is huge, and chiropractic plays a huge role in correcting the spine and improving lives. Now, in order to understand what I want to show you about subluxation, we have to first understand what a normal spine looks like. And this is a cervical x-ray. This gentleman is facing to your right, if you're looking at the screen. Here's the back of his head here. Here's the jaw. You can see a couple of teeth there. This is a good normal cervical spine. You can see a good curve from the side right there. In fact, we measure this. This is a 43-degree curve. Should be between 40 to 45 degrees. These dots are at the back of each spine, each vertebrae, and those dots should pretty much line up with that line. You can see that these dark spaces in between the vertebrae, those are discs. They're nice and open. There's no sign of arthritis or degeneration. This is a good, healthy spine. But what I want you to do is take a good look at this x-ray and compare it to the next one that I'm about to show you. So here's the next one. Okay, can you see the difference? Now, this black line here is where that curve was, and in this person, we have lost that cervical curve. It's actually curving the other direction. You can see that we're starting to get a little bit of disc degeneration, and that it's beginning to get pointed, and we're seeing indentions in the disc and through that area. We call this phase 2 subluxation degeneration. Now, there's a neurosurgeon by the name of Alf Brigg, and this Dr. Brigg actually won the Nobel Prize, and what he showed was that when we lose that cervical curve, it stretches, it puts tension on the spinal cord and the nerves in that area. So I want to show you, take a little bit different look at this. Here's the normal cervical curve. This is an x-ray of a normal spine. This is actually a cadaver study, but you can see how that spinal cord sits in that good curve here. Now in a phase 1 subluxation degeneration, you can see how we lose that curve and it gets very straight. This is an x-ray here. Okay. Now in phase 2, it gets even worse. And you can see how we even start to get some reversal of that curve and some arthritis and degeneration that starts to move in there. Now what I want you to imagine is if this spinal cord was elastic, let's say you could stretch it, and if you stretched it, would the diameter of it get bigger as you stretch it, or would the diameter get smaller? Well, hopefully you say smaller, and I'm going to show you what I'm talking about. Here's a cross-section of what we just looked at. So basically we took the spine, we cut it across, and now we're looking down into the spinal cord and the spinal canal. You can see how this spinal cord is nice and full and takes up, you know, a lot of space in the spinal canal. Now, what I want to show you in this next picture is just the spinal canal of a phase 1 subluxation degeneration, and look how stretched, how tight that spinal cord is, and all that's from loss of the cervical curve. Ladies and gentlemen, the cervical spine and that important curve may be one of the biggest kept health secrets on the planet, and I've been blessed to see a lot of patients since I've been practicing, and some of the healthiest have some of the best alignment in their spine, and some of the sickest have some of the worst alignment. So I'll actually want to show you an x-ray of a lady that came into the office. This is the same type cervical x-ray. The patient is looking to the right. Here's her jaw. You can see the teeth here. This is the back of the head. And look how straight the neck is here. And what I want you to notice is these disc spaces, how they're gone, just almost completely gone. It's bone on bone on bone. There's the degeneration and bone spurring in through the front where these arrows indicate. This is phase 3 subluxation degeneration. Now, the interesting thing with this patient is that when she came in, she said, you know, I went to my medical doctor last week because I had a crick in my neck, a pain in my neck, and she said he didn't even do anything, just looked at me and started writing down something on his prescription pad. And she was, she told me, she just said, no thank you. She said, I want to find out exactly what's causing this problem. And so she went to the chiropractor, and this is what we found. You can see that we've definitely got a lot of work to do. Actually, this patient has been under care, and she's doing a lot better. She's improving. But another interesting thing that she said was that a couple months ago her neck started hurting, but before that she's never had any problems. Now, ladies and gentlemen, I'll tell you, this did not happen in a couple of months. This is 10 to 20 years of subluxation degeneration. Now, why did it just start hurting her a couple of months ago? Well, the fact is you can't feel this process of subluxation. What you feel are the effects of it when it gets bad. When it gets bad enough to put pressure on a nerve, that's when you feel it. And I use a lot of dental analogies, but here's one of the best analogies for this, is the day that you feel a cavity, the day that it starts hurting you, is that the day the cavity started? No. In fact, dentists say that it can be there for years before you ever feel that, before it ever gets bad enough to hit the nerve, put pressure on a nerve, and that's when you feel it. Same thing with subluxation in the spine. Another reason why, if you remember the first thing that I said, the spine should be checked early in life, and it should be routinely checked and adjusted throughout life. And here's a great reason. When we go to the dentist to get a checkup, to get our teeth cleaned, they also check for cavities. So they can actually feel a cavity before you ever even have pain, and you don't even know you had one. That's the way it should be with chiropractic and with keeping the spine healthy as well. Now, this x-ray, this is the worst x-ray I have ever seen. This gentleman is also looking to the right. Here is his jaw, right here. This is the back of the head. You can see the back of the skull here. The cervical spine should be way back here on this black line, and he's stuck in this forward position. The spine is completely fused, bone on bone. You can see he's actually had surgery. They've wrapped wire around his spinous process, and he has a couple of areas here where the wire is actually broken. Now, this would be extreme phase 4 subluxation degeneration. And when we put these next to each other, the good spine versus the phase 4, we begin to really appreciate what a good healthy spine looks like. Now, let me ask you a question. Looking at these two, which one is going to have a headache first? I hope you said this one on the right. And more importantly, which one's going to have high blood pressure first? Which one's going to have health problems first? The spine contributes to the overall health of the body. You have nerves, particularly the vagus nerve from the upper part of the neck that travels straight to the heart and lungs. So any type of pressure on these nerves can affect the health of the body. Now this is a lumbar spine. This is the low back, and this person is also facing to the right, so this would be the belly, this would be the back. Here's his belt line. The belt line would be about right here. You can see the good curve that we should have in that lumbar spine, in that low back as well. You can see these disc spaces are nice and open. You can see the nerve at exits here is nice and open. There's no pressure on the nerve there. This is a good, healthy low back. Now what I want you to do is compare this one to the bad one. Okay, can you see the difference? Can you see how straight it is? How we've started to lose disc height in through here? The openings where the nerve come out is starting to compress. You can see arthritis and bone spurring into the front there. Now which one of these two is going to have low back pain first? It's pretty easy to understand the one on the right is going to have, most likely, low back pain first. Now, which one's going to have bowel, bladder, kidney problems? The nerves that come from this area of the spine control your organs, control your intestines, your digestion, the kidneys, the bowel, the bladder. All those things, the control of those things come from this area of the spine. So if there's pressure on the nerve, whatever that nerve goes to won't function like it's supposed to. Now this, I'm going to show you some case studies. Now this little guy is only 5 years old. You can see how straight his neck is here. He had a lot of issues with ears, eyes, nose, throat, sinus infections, ear infections. In fact, Mom said that they had to put tubes in his ears. Didn't work. The tubes popped out. He kept having ear infections. And in fact, the mother said he'd probably had over 100 rounds of antibiotics since he was born. He's only 5. Now, how does a spine in a little 5-year-old, because whether you're 2 or 102, you should have this good curve. How does a spine in a 5-year-old get like this? Well, the mother also said he had a very hard delivery. He was, a typical kid who had spills and crashes and crashed his bike, but he was also the goalie on his Little League hockey team. So what I want you to do is compare this. Kids get better so quickly. They're so resilient. Here is a 3-month x-ray of before and after. No longer having ear infections or sinus infections cleared up, and hadn't had another round of antibiotics in over a year. So phenomenal results there. Here is another case study. The lady had headaches, neck pain. She even had pain that would radiate down the arm. You can see how straight, even slightly reversed, the cervical spine is here. And you can see where there's pressure on the nerve in there. Now this is a follow-up study, and you can see that the spine is actually improved. We're seeing a better curve here. It's not completely back, but it is good enough for the symptoms were completely gone. No headaches, no neck pain. The pain down the arm went away as well. Now this patient didn't stop here. She continued with wellness care and weekly adjustments, and I want you to see the next follow-up x-ray. So beautiful correction of the cervical spine, and a great example of why you don't just stop care once you're out of pain. We want to make sure that your spine is corrected. And then she continues to just have wellness care and checkups to make sure that she's subluxation free. So one more I want to show you is the low back. This is the low back. Here again is the belly. This is the back, and the belt line would be about right here. And you can see how off this lower part of the spine is. There should be a good fluid curve all the way through this low back. One thing I really want you to notice is the disc spaces here. You can see disc spaces. You see it starting to narrow here, and then you can see that this disc space here is almost gone. We've lost a lot of that disc space. Now, with aftercare, I want you to see his post x-ray, 1-year x-ray, and look at these disc spaces. Disc space, and look how improved this alignment and this disc space is. And the pressure was off the nerve. This gentleman had come in with pain shooting down the leg, completely resolved, and the disc has actually started to rehydrate and take pressure off of that nerve. Now his family comes in for wellness care. They all get treated. Now what I just showed you is what we call corrective care. It's complete restoration, and the important thing with corrective care is the chiropractic adjustment. It's what aligns the spine and takes pressure off the nerve. Now, some recommendations that I always give my patients is you need to keep your appointments because your body responds to time and repetition. Okay? Then also one thing I say, and I say it in a completely good way, is don't start unless you're going to finish. And I just say that because I want to make sure that you have the best results in my office. Now, another very important part of corrective care is the exercises that we give you, and that's to set the adjustments. Muscles in the spine provide strength and stability, and so whether you do your exercises before or after the adjustment doesn't matter as much to me, but as long as they're in conjunction with the adjustment so that those adjustments can stay longer, your back can be more stable. Okay? Now, I get this question a lot. What happens after you correct my spine? So after we fix it, then what? Well, let me give you this analogy real fast. What if you wanted to get in great shape, right? And so you joined the gym and you started going to the gym consistently for 4 to 5 months. And you got into great shape. And then you just completely quit going to the gym for the rest of your life. You just completely quit. Do you think you'd keep that fitness? No. In fact, someday you would get out of shape again. And that's exactly why I recommend wellness care. Now, as far as wellness care goes and your frequency, for me and my family, we get adjusted 1 time per week. And as you know, I would pick only the best for my family, and I know that getting checked and adjusted once a week is the absolute best, and that's why I recommend it for my own family. And that's also why I recommend it for my practice members, because they're part of my family as well. So I highly recommend a once-a-week adjustment, and I try to make it very affordable and very reachable for my patients to be able to get checked and adjusted once a week. But with that said, I do have people who come in every other week for their wellness adjustment, or monthly, and so it fits your goals and what you want. But wellness care is a great idea. And then what I want to end this discussion with is spinal hygiene. Now, a lot of people really don't understand what spinal hygiene is. Now, let me ask you this. How do you keep your teeth healthy? Well, when I ask that question, pretty much everybody says, well, I brush my teeth, right? You brush and you floss. So how do you keep your spine healthy? Well, you've also got to practice spinal hygiene, but it's in the form of exercise and stretching instead of brushing like your teeth. Now, that's why we use homespinalcare.com, because it'll actually help you to better understand what spinal hygiene is and what exercises and stretches you can do on a daily or weekly basis to make sure that you keep good spinal hygiene. When you go to homespinalcare.com, you can instantly download a free ebook, and this ebook will tell you, is all full of all kinds of information, and will help you to understand what spinal hygiene is and show you exactly what exercises and stretches to do. You'll also receive 4 videos. The first video will show you how to administer ice therapy, heat therapy, and contrast therapy, and how to do that properly. The second video will show you our spinal range of motion stretches. This is something that you should do on a daily basis. It's a real easy 2-minute exercise that will help you keep proper range of motion in the spine. The third video will show you how to strengthen postural and core muscles through different exercises. Remember, exercises and strengthen muscles, and muscles provide stability and strength to the spine. So again, very important. You'll also receive the 4th video, which is a really awesome procedure or exercise called spinal molding, and it'll help us to keep those natural curves, along with your chiropractic adjustments, of course, but it'll help us to keep those good curves and help the adjustments set and hold a little bit better. So it's full of great information. One thing I want to leave you with, though, is spinal hygiene, spinal exercises is a must, but it's the chiropractic adjustment that can completely change your life forever. It's very powerful. I just want to thank you again for watching this presentation, and again, go to www.homespinalcare.com for more information, and Just Dr. Tabor saying thank you very much. Have a great day.